Hi, it's Dr. Daly. Thanks for taking a few minutes to listen to me talk about our D10 substitution. As you may have heard, there have been a significant number of medications shortages this summer. And one of the first medications that we've run out of in many hospitals and at many agencies is D50. Brian Taft and several other paramedics from Saratoga County have been extremely influential at helping us put together this substitution program and have designed a system that I think will work well for administration of 10% dextrose in the field for treatment of hypoglycemia. If you haven't heard about the medication shortages, you're going to hear more because the shortage of D50 is just the tip of the iceberg. But one of the things that's very important to the members of the MAC, and obviously to our patients, is to make sure that in any of our emergent substitutions, we're taking care of patients just as well as we would have in our standard care. What we're doing now is we're going to collect data from both patients that are getting D50 as well as patients getting D10 to assure that there is equivalent patient care. This presentation is going to review the procedure for administration of D10 and will conclude with the demonstration of the data sheets we're going to use to collect information on the administration of the 10% dextrose. Required equipment should be available to you to look over the setup. And it's important not just to watch this brief slideshow, but also to touch these pieces of equipment, because things like the stopcocks that you don't use very often don't quite make sense if you don't hold them in your hand. The required equipment for administration of D10 is a 250 milliliter bag of 10% dextrose, a macro drip to come out of the bag of dextrose, an IV extension set, which makes a big difference between the IV and the patient and the stopcock, 2 three-way stopcocks, flushes, and a 50 cc syringe. If you've never used a three-way stopcock before, please take some time and get used to them. The long arm of the stopcock always points to the valve that's off. That takes a little bit of getting used to. But once you get used to administering medication through a three-way stopcock, it's actually much easier than pinching off tubing, which is one of the ways that we traditionally have done that. Assembly itself is very simple. Connect the IV tubing and run through as you would any IV fluid. Connect the three-way stopcocks. Connect the administration set and the extension set. And then make sure that indeed you've got dextrose through the entire line. Assembled it looks something like this. In order to administer the D10, you're going to take a 50 cc syringe and attach it to one of the stopcocks, and attach your flush to one of the others. Make sure the flush syringe is off, or the long arm of the three-way stopcock is pointed towards the flush, and make sure the D10 is open to the bag. If the D10 is open to the bag, as demonstrated in this slide, you can then fill the syringe of D10, the 50 cc syringe. You then move the stopcock lever to point it towards the bag, open up the valve to the patient, and push the 50 milliliters of fluid into the patient. Then flush, using the exact same procedure, making sure that the flush is off to the bag and open to the patient, and flush the 50 milliliters of dextrose with 10 milliliters of saline. After that, please check the administration site at the IV and make sure that indeed there's been no extravasation, that the site still looks patent. If the patient is elderly or has a history of congestive heart failure, you may want to check lung sounds between each administration since we're giving slightly more fluid. And check and see if the patient's mental status has improved. If the patient's mental status has improved, you may not need to give the full 25 grams or 250 milliliters of dextrose. There is no requirement that the patient gets the entire bag. In fact, for some diabetics, they may be better off without getting that much simple sugar. After you've completed this, please make sure that you finish completion of each of the elements of the data sheet and turn it into your supervisor. Here's the data sheet. You'll notice it's a quality assurance equivalency review. There are no patient identifiers recorded on this sheet. Age and gender are recorded, initial Glasgow Coma Scale, initial blood glucose. The last time the patient was seen normal will give us a little bit of an indication as to how hypoglycemic the patient is and the time of your patient contact. You'll notice your name and your unit number are not on this either. Each syringe of D10 that you administer, record the time that you initiate the administration, whether or not there are any complications, and whether or not the patient regains an improved level of consciousness. If the patient has no complications, and if the patient doesn't improve with the administration of a syringe of a D10, then administer the next syringe of D10. After the full 250 milliliters, or after the patient regains a normal level of consciousness, fill out the rest of the outcome information. If the patient regains normal arousal, write down that time. Write down the time that the patient regains their baseline or comes back to Glasgow Coma Scale of 15, as not every patient is going to have a Glasgow Coma Scale of 15 at their baseline. Please check a repeat blood glucose so we have an idea of how high we've gotten that patient's blood glucose. We'd like to know if these patients refuse transport. We'd like to also know whether or not we have patients that are frequent hypoglycemic patients, or whether these are very rare events for our diabetic population. Which medications the patient's on, and whether or not they have an insulin pump, are things that we're going to use to make sure that we have equivalent patient populations between the arms of our hypoglycemic patients, getting both D50 and D10, to make sure that we have similar patients. If the patient knows that they're on an injection and doesn't know what type, or knows they're on oral medications but doesn't know what type, please just check the box. When you've completed the form, please turn the forms in to your supervisor or to your ALS coordinator, and they will all be completed and sent to me for recording and for data analysis. I think this is a really important project. It's going to give us a lot of information about our treatment of diabetics and REMO, and most importantly, in this emergent situation where we have a significant drug shortage, it's going to give us an opportunity to make sure that we're taking good care of our patients while managing to weather this storm created by poor supply of medications for us. Thank you very much for your help. We would not be able to do this without you. If you have any questions, feel free to contact your ALS coordinator or contact me directly. You can get my email address linked on REMO's website, or it's remomd@nicap.rr.com. Thank you very much.